What do I do for a living? Well, I'm a clinical psychologist. I work primarily with people suffering from mood and anxiety disorders. I also have a special interest and training in post-traumatic stress disorder. So I work with members of the military and the police service. How did I get started in psychology? It's a pretty long story. I guess I started actually in microbiology and took an intro psych course just to fill in part of my art side of the degree, and realized that I really was passionate about the subject. From there I actually started, or at least I went into a Master's of Arts in research side of psychology, cognitive psychology. And actually, while I was doing that, also did a certificate in applied behavioral analysis. And from there, started work as a behavior analyst, which got me into the practical side of psychology. And then from there, it's basically history. I started looking for clinical programs and ended up in California, where I did my Doctor of Clinical Psychology at PGSP, Stanford Psyche Consortium. What makes me a good psychologist? Well, I like to think I'm pretty personable and approachable. When I first meet with clients, I really try to structure the environment so that it is as comfortable as it can be, and really try to foster the therapeutic relationship, which, as we know, is one of the key components of psychological treatment. How do I gauge when therapy is successful? Well, to start off, I use a variety of different assessments periodically throughout treatment, but I also practice from a very open and collaborative approach. So I do check in very frequently with clients to see what's working, what's not, so adjustments to the treatment can be made on an ongoing basis. What's the most rewarding part of my work? I think it's really the challenge of using psychological theory and techniques with my clients, and having them learn these techniques, use these techniques to start to adjust their patterns of thinking, and using it to have a different approach to what's going on an everyday basis. It really is detective work, I find, and that is really one of the most enjoyable parts for myself, and especially once I start to see that the client is connecting with that and getting the benefits from it as well. Do I have any final comments? Yes, I very much look forward to working with future clients at WGM Psychology and Associates.